Hi guys, Ariana here at the AEFE Training Center, and I am working with my patient on a submental smooth threads with PDO treatment today. So I did numb her before the treatment for about 20 minutes, just because that seems to be the fine, perfect amount of time and space for my patients to be able to feel comfortable but not have that numbing linger on a little bit too long. So I'm just wiping it off and wiping it off with a 4x4, and then I wipe it off with an alcohol swab just to prep the skin and make sure it is as clean as possible. I definitely don't want to run into any infection concerns. So I am prepping the skin, and when I place these threads, I am going in the tissue at a 45-degree angle and gliding parallel with the tissue once I break through and puncture through that tissue. So 45-degree angle, I level off and I advance that smooth PDO thread. So for her, this patient specifically, this is her second treatment that she is doing on the dot every 4 weeks of 3, and then we will reassess after the 4 weeks after the third treatment. So a 3-month treatment in total, spaced 4 to 6 weeks apart, is pretty much what I tell my patients. Now you can see too, something else I want to point out is that I do have to put a little bit of pressure into the tissue after I kind of meet the tissue with the marshmallow, is what we call it. And that is just because I did pick a longer and thicker thread. In my mind, when I have patients in my chair, they are taking time out of their day. They are numbed. They're going to be having this numbing on their tissue for probably an hour to an hour and a half after they leave my office. So I want them, if they're going through all of that, to have the most dramatic results possible. I want them to, have the best bang for their buck. So I do pick, especially in this area, a thick thread, a long thread, and I do a good amount as well. So I am a little bit on the higher end when it comes to doing smooth PDO threads, just because I want them to have great results and not need to do more than the 3 treatments. So I did do 20 smooth threads here in the submental area, and since I picked a thick one, that's why you kind of see me having to push a little bit harder once that marshmallow meets the skin. So I'm just keeping them in place. I did a little bit of a horizon area, a horizon image, or a rainbow, or however you want to call it, in this submental area, just because I noticed that gives me really nice even spread. And patients are very happy with the results doing this. Now, that's not to say that this is the best way to do it, just because there's no right or wrong when it comes to smooth threads. And whatever is working for you and giving you results, you can continue on doing. You can do a fanning technique, you can do hashtags, you can do this horizon. It's kind of wherever you prefer as the provider and what's giving you results. So we do teach this both virtually and in our level 2 Botox and filler course. We allow you to get some hands-on practice in both of them. And walk you through picking smooth threads, how to inject them, follow-up, complications, every kind of issue that you could experience with threads. So this is a great option if you're trying to add some more skill set to your practice. So really am a huge fan of doing smooth threads. I find my patients are extremely happy with them. They're very safe and just very effective. So with that being said, I'm just twisting 360. I'm finishing up the treatment, and I am pulling out the threads and putting them right into the sharps container. And then I will clean my patient off and just make sure that I don't see any little stray ends of the thread. And then she's good to go, and I book her for 4 weeks, and I see her back, and we repeat the cycle. But the area just gets tighter with time, and my patients get happier. I hope you enjoyed this video, and I'll see you guys in level 2 and virtual.